Hello everyone. Today let us understand intrapulpal anesthesia. So coming to intrapulpal anesthesia, those whoever are doing endo constantly will have very high regards for this intrapulpal anesthesia because it works wonders even when the blocks are failing. But for it to work properly, you should also understand the mechanism of its action and also the right technique to actually give the intrapulpal anesthesia. So first let us understand why this intrapulpal anesthesia works better even when the blocks or infiltrations are failing. So when you give the conventional infiltrations or blocks, you give them in the empty space, while when you give intrapulpal, you give it directly in the pulp. So this makes all the difference. When you give the regular infiltrations in the empty spaces, what they do is they go and block the nerve conduction. So they act by blocking the nerve to send responses to the brain. But coming to the intrapulpal, when you give the intrapulpal directly in the pulp, you give it with pressure. Intrapulpals is never given without pressure. Intrapulpals are always given with pressure, and that pressure creates so much of the pressure inside the canal to actually destroy the pulp. So there's no nerve conduction or blockage of responses happening here. It's the complete destruction of pulp that is happening here, which is making a difference between the anesthetic mechanism of action. And what difference does this make? There, the block has to be done at the nerve level, where nerve is still there. You're just temporarily blocking its conduction. But here, you are completely destroying the pulp. The uh, injection is given with so much of pressure that inside of the nerve canal, inside the root canal system, the injection is creating the liquid that you're giving is creating so much pressure into the pulp that the pulp expands, and at a point it completely crushes and there's no pulp left to even send the response. One thing in your infiltrations and blocks, your tissue is still intact and it has no potential to send responses. But in the intrapulpal, your tissue is completely destroyed, that there is no tissue is present to even send the responses. So if you have to understand it with an example, you can take an example of a balloon where you blow in the air into the balloon. You keep blowing it, keep blowing it, keep blowing it until it is completely bursted. That is what happens in the intrapulpal anesthesia also. You inject the liquid and give the pressure over to the pulp until it is completely bursted out inside the canals. That is what happens in the intrapulpal anesthesia, and that is the reason why it works very well, because there is no pulp left inside the canal. So when there is no pulp left inside the canal, there is no conduction also that is supposed to happen. So that's why your intrapulpals are very good alternatives for the failing or the hot tooth cases. So make sure you use the intrapulpal anesthesia whenever required. Do not be scared of intrapulpal anesthesias. They are a really good means of anesthesia in case of hot tooth cases. Now, what is the technique that you do intrapulpal anesthesia? So whenever you take a tooth and you want to give an intrapulpal anesthesia, you never place your needle inside the pulp chamber. You should be aiming into the pulp canal. So this is where you have to be giving the anesthesia, not inside the pulp chamber. Because when you give it inside the pulp chamber, there's a high chance all the liquid can move out of the tooth and do not cause the pressure that is required. But when you actually give the intrapulpal anesthesia, the most important part is giving a lot of pressure to the pulp so that inside all this area the pressure is built onto the pulp, and the pulp is completely destroyed. So that is what the proper technique to give an intrapulpal anesthesia is. You never give it in the coronal part. You aim the needle into the canal and then deliver the anesthesia. And it is normal for the patient to have the pain during the intrapulpal anesthesia for the first 2 to 3 seconds or 5 seconds. And after that, the patient will cooperate you very well because the pain is gone very instantly. When given properly, intrapulpal anesthesia is a very good technique which might cause a pain for 2 to 3 seconds or 5 seconds, and then the pain completely subsides and the patient's cooperation increases drastically because there is no pulp left, so there is no need of nerve conduction to happen. So once the pulp is completely out, there's no pulp that is left to send any signals of pain. You can work very peacefully, and that works really well